This is Chanel Probst. I'm a graduate assistant in the wellness department. And this is Bethany Weaver. She's a wellness ambassador. And today we're going to be talking with Dr. Kansagor and Dr. Cunningham on sexual health. Dr. Kansagor, can you provide a little bit about your title and your line of work?
Sure. My name's Adam Kansagor. I'm board certified OBGYN with the Department of Medicine over the Brody School of Medicine. I do women's exams. I focus on sexual health, and I've been in Greenville for about 7 years now.
Awesome, thank you. Dr. Cunningham, can you provide some information on your title and line of work as well?
Sure. I'm Karlene Cunningham. I am a clinical health psychologist here in the Department of Psychiatry and Behavioral Medicine. I do both outpatient and inpatient practice. I specialize in sexual and reproductive health as well as all other aspects of mental health. Do a little research on the side.
Awesome. So it sounds like you do a lot in your field. So today we're going to get started with some questions, and Bethany is going to start us off.
All right. For our first question, our question is, can you use a male and female condom at the same time?
No. So when we think about condom use in general, especially if we have a male condom and a female condom, when we're pulling those things together, we get friction. Anytime there's friction and latex or other types of thing, we have increased the risk of it breaking. So it's never really a good idea. But any one of those can provide really good protection against STIs.
And also pregnancy. As long as we're talking about friction with condoms, it's also important that when you're using your condoms, you know what type of lubrication you're using, because some lubrications are not good for condoms because they could break them down. And if the condom breaks down, you could have a risk of pregnancies, you have a risk of STDs. So in general, you want to stay away from oil-based lubricants, any type of petroleum, Vaseline, lotions, things like that you want to avoid. You want to stick with either water-based lube or a silicone-based lube. All of those are available at whatever pharmacy you want to go to.
How do I talk to my partner about sex, and what are good forms of communication?
So talking about sex in general can oftentimes come with a lot of different emotional angst, right? But it's really important to be able to talk with a person that you're going to engage in a sexual activity with early and often. I usually recommend that people have conversations about sex, not while sex is about to happen, or even just after maybe bad sex happened, because sometimes we want to talk about it then. I usually suggest that we set up a time kind of beforehand when both people are feeling pretty relaxed, and just saying that, hey, I want to talk about, kind of what we're doing sexually, and maybe hit a couple of different topics. Usually during these conversations, I encourage people to use what I call kind of more I statements. So you can talk about your personal experience with what's been going on, and your partner can talk about their personal experiences, instead of saying things like, you do this and you do that. More of, I feel that this is, not going right. I'm not feeling the sensations I want in my body, and I want to be able to kind of come to an understanding or explore what it is that could change. I maybe want to add something to the sexual mix, or take something away. It's also really important early in a relationship, before we start engaging in sexual activities, to kind of talk about folks' health status. This is a really important conversation to have, talking about the number of partners people might have engaged in, when their most recent testing was, just to make sure that everyone is safe. Safe sex is pleasurable sex.
I know you guys mentioned the importance of getting tested, so how often should you get tested, and where are locations you can do that at?
Well, in general, for a person that is sexually active, at minimum, we want you getting tested at least once a year, right? If you are at higher risk, so maybe infrequent condom use, higher number of partners, then getting tested every 3 to 6 months can also be really beneficial. There are lots of different places where you can get tested, so you can go to your regular provider, be that your primary care doc, your OBGYN, whomever, and just request a test. You can also go to the health department, which also provides testing, and there are oftentimes kind of mobile clinics and things like that that will do free anonymous testing for different STIs as well.
Yeah, and a lot of times I have patients that show up and they say, I've just had sex with someone, I found out they're cheating on me. Things like that. And it doesn't matter what type of sexual relationship you are, same sex, intersex, it doesn't matter. In general, if you have a new partner, you want to make sure you have a clean bill of health. And also, STDs have different time frames from exposure to when they present. In general, if you want to just take each of the STDs has a different timeline, but for the most part, they all happen from day 3 to day 12. As in, you've had sex with somebody 12 days later, you now have something that's testable. And the stigma attached to being tested for STDs, it's important to know what that actually means. A lot of times people are scared because there's a Q-tip that goes down your urethra or where you pee from, which sounds awful. We don't do that often anymore. And the standard of care at this point is usually giving a urine sample or doing a blood test. And the blood test will check for things like HIV, hepatitis, syphilis, and a Q-tip test, which doesn't have to have a speculum. It can be patient-directed for female patients, where they take a little Q-tip that you would, clean your ear with, very small, and they just hold it in their vagina for a little bit, and they give it to you, and that's it. And they send that off, and that will test for gonorrhea, chlamydia, trichomonas, bacterial vaginosis, yeast, things like that. So get tested often, and there's nothing more gratifying and empowering than going out into the dating world with literally a clean bill of health, and you say, this is what I've been tested for, your turn. And now they show you their proof, and then you still should protect yourself because you can't, unfortunately, trust everybody. But at least you know going into it that you are very in charge of your sexual health, and it's important to you as a person. And if you want to be intimate with me, you better prove to me that you are willing to be safe.
I do want to just clarify one piece in terms of we continue kind of slightly different terminology in terms of STD versus STI. They're essentially talking about the same thing, but sexually transmitted disease versus sexually transmitted infection. Some of the lingo that we use kind of has shifted over the years, and so both of them are referring to the same thing.
Okay, so while we're on the topic of STIs, can you get an STI from oral sex?
Yes, absolutely. And both men and women that are giving and receiving can get STIs, whether you're giving or receiving. Typically, people that are receiving, if someone's performing oral sex on a male and they are the receiving end of that, they have a higher chance of infection than vice versa. You could get herpes. There's two types of herpes. There's type 1 and type 2. But they can communicate. So if you have a type 2 herpes vessel down below and someone goes down and they come back up, they could actually get that type of infection on their lips. Other things that are concerning is you could get actual chlamydial infections and gonorrhea infections in the throat from oral sex. And while we're having things in the face area, you could also get conjunctivitis. You could get pink eye from, stray bodily fluids. So just something to think about. The best way to protect yourself against it is if you're performing oral sex on a penis, to have that person put a condom on. If you're performing oral sex on a woman and a vagina, use a dental dam, which is kind of like saran wrap. Truth be told, not many people use it. I've counseled people about it, but there's any type of physical contact with any genitals, there's risk of getting an STI.
All right, now let's talk about the fun stuff about sex. What are the male and female G-spots?
So the mythical, the male and female G-spot. So in general, the male G-spot, if you could call it such a thing, is essentially the prostate. The prostate is an organ that is in charge of essentially providing nutrition to the sperm so they could be happy and live before, they have their short life where they die after 5 days. It adds lubrication, it adds a lot of things, but the prostate has a ton of different nerve receptors to it and pressure receptors. The catch with the male G-spot is to get to the male G-spot, you have to go through the bottom. So you got to put a finger up, a partner's butt, and a lot of times they're a little freaked out by it, but the process of getting to said G-spot is different on women versus men, because in men, if they're laying on their back, you basically go in and you have to reach up. It's the same motion as finding the G-spot in a woman, but it's only about 2 to 3 inches inside, and there's this kind of like rounded plum feeling thing. And the benefit of the prostate is if you add pressure to it during sex, it could amplify things. In fact, from a scientific point of view, men that have spinal cord damage, that they are not able to physically have an erection and they want to make babies, they actually have technology where you essentially stimulate the prostate rectally and it causes that person to ejaculate. So this organ has a purpose. It's just you have to go through the bottom to get to it, and that intimidates a lot of men, obviously. The female G-spot, which is, you know, what I work with a lot more as a gynecologist, is not invented, but originally identified by a German gynecologist back in the early 1900s, late 1800s. And it's essentially from an anatomic point of view, if you put your finger in the vagina, the person's laying down, you put your finger in the vagina and you go about 2 inches in with your fingers, and usually it's the come hither motion, and that is usually where you would find the G-spot. The G-spot is not a come all, one all thing. So certain people, the G-spot works for them, certain people it doesn't. From a physiology point of view, what it actually is made of is called the periurethral sponge. I know that sounds really cool and sexy, but it's essentially a bunch of nerves that are kind of, if you were to talk about the clitoris, and I'll let my colleague talk about it because she's super excited about the clitoris, and I don't want to steal her thunder. If you were the clitoris, you have a tree trunk, essentially. There's some legs, and the roots that come down, those kind of perforate through to the vagina. So you have a collection of nerves right inside the vagina that are kind of directly hardwired to the clitoris, which is the most amazing organ ever. Its only purpose is pleasure, which is cool. We don't have that in a male's body. Our sex organs have multiple purposes, but they're not just a one kind of thing. And as far as how to identify it, some people like it, some people don't. And from what women describe, sometimes it feels like you have to pee. Sometimes it feels good, sometimes it feels bad. And the biggest issue, again, is communication. Just because you read about the G-spot on the internet doesn't mean you should just go in there, no foreplay, and just start mashing away at this spot.
So as we're talking about the clitoris, it is a mythical, magical, amazing organ, and oftentimes very misunderstood, right? So most times we kind of think about the clitoris as being the tiny little piece that is kind of visible on the vulva, right? So if we're thinking about female genitalia, typically there is the outside, which we call the vulva, and the internal canal, which is the vagina. And so oftentimes we use vagina to kind of just describe everything, but here we're going to separate those two terms. So now the clitoris is not just this small piece that's actually more of the clitoral hood, and the actual clitoral complex is actually much larger, and it is about the size of a kind of a small penis, essentially. Well, thing, flaccid penis, and it extends into the body, and it has legs, right? It kind of has actually a couple of legs. And when people are talking about stimulating the G-spot, a lot of the time, yes, we're hitting that complex as well, but we're also stroking the legs of the clitoris, so we're getting additional internal stimulation of the clitoris. And so we often try to make this distinction between a G-spot orgasm and a clitoral orgasm, but it's all clitoral, right? So because the clitoris is much bigger than what we are thinking about. What we end up finding a lot of the time is that people that have vaginas and vulvas don't take time to actually look and experiment and appreciate the organ that they have, right? And being able to find out what is actually pleasurable for them, right? And so a part of identifying if something like a G-spot or that portion inside or stimulation of the legs of the clitoris is pleasurable takes a little bit of practice and trying to figure out what type of pressure you might need. So do you want hard pressure? Do you want it's kind of consistent? Do you want strokes? Do you not? Do you want actually just enough stimulation on the head of the clitoris? The clitoris itself is very, very sensitive. It has more nerve endings than the entire head of the male penis, right? So that area can pick up on a lot of things. And so some folks don't like direct pressure or contact to the clitoris, but more just edging maybe around it or on top of the hood, right? And so these are the parts where we have to take some time to be able to explore our bodies and be able to say, I like this, I don't like this, and then communicate. We'll always come back to this idea of communication. And the fun of sex and the pleasure of sex is being able to get to know your body and allowing your partner to also explore and find those things that you like and they like.
And going back to, so the male, there's obviously the prostate, that's what they refer to as the male G-spot. But the penis, if you're looking at the nerve distribution and where is the most dense collection is usually the head of the penis or the glans, and specifically underneath the penis. So if you're looking up top, you have the urethra where you pee from. Underneath there's this kind of like teardrop shape, and if you're circumcised, there's kind of this little skin anchoring. And they sometimes call that a frenulum, which is also like if you pick your tongue up, that thing that you see underneath your tongue, that area of the penis is very sensitive as well. As far as figuring out what your most pleasurable part is, it's just a matter of playing with it, figuring it out, and exploring.
How do I know what type of birth control one should go on?
So everybody's birth control is different based on what their preference is. When I counsel patients, I kind of ask, what are you interested in? What have you heard of? What are the good, bad, and ugly about all of the birth control options? And the best way to do it is to talk to your provider and kind of go through things. In general, as healthcare providers, we're really big fans of what's called the LARCs, or the long-acting reversible contraception. And these are what are called the IUDs, or the Nexplanon, or the implants. And the IUDs are a little plastic tee that goes inside the uterus. It's done in the office. It usually causes some cramping, some spotting, but it's usually good from anywhere from 3 years to 10 years, depending on what type it is. And an added benefit of some of them is it actually makes your periods very light, or it stops your periods altogether. The benefit from a birth control point of view is you, as the patient, can't screw it up. It gets put in, and then 5 years later, or 10 years later, or 3 years later, we take it out. Same thing with the Nexplanon, or the implant. It's a little thing that goes in your arm, and it's good for 3 years. And again, it's good because you don't have to think about taking a birth control pill every single day, because life is very stressful. I have 2 kids, and I had them in my 30s with a good job and being married. It's really hard to raise kids, and nothing will throw off your college game like having a human. So birth control pills are cheap. They're easy because of the Affordable Care Act. Almost all birth controls are covered. You can get them at the health department, the student center, any doctor that you want to go to. And you have to have a good conversation with them about all of the symptoms and side effects that come with all of them, because not every woman is the same, for obvious reasons. So not all birth control works for everybody. Some people love birth control A, and other people think it's terrible. And then the internet will take something and go crazy with it. So that's why I say, tell me what you've heard of, what are the myths that you've heard of, and I could maybe kind of answer them for you. But number one, with all birth control minus condoms, you can still get sexually transmitted infections. And I hate to bring it back to that, but the best thing you could do to protect yourself is to not have humans when you don't want them, not get STDs when you don't want them, and maintain yourself.
And what I would add to that, again, kind of just reiterating this aspect that there are a lot of different varieties of birth control methods that are out there, and are very unique for each person, right? And how their body and their chemistry reacts to it, and how it impacts their sexual practices and their arousal patterns and things like that. And being able to notice some of those changes is really important. Also, in terms of the mental health side of things, also being on birth control can also kind of have some changes in that. And so just being able to kind of notice if there are any changes in kind of your mood, anxiety, so on and so forth, just to be able to kind of take a check and say, okay, is this how I was feeling kind of before, and how long did it take for me to start feeling this way, and let me make sure that I bring that up with my provider the next time I go.
Okay, so another question is masturbation. So is this common for students to do?
It is completely normal. The issue you have in college is proximity. So if you're in a dorm room and you're physically right next to somebody, it will be harder for obvious reasons, because if you're getting loud, if there's movement, you don't want to embarrass yourself. So a lot of times you have to create a safe space for you and a safe time, because the best way to enjoy yourself is to be as relaxed as possible. If you know that someone's outside and they may be walking in at any moment, that is very stressful, and that will take away the fun of it. And again, like Dr. Cunningham said, is essentially figure out what you have. I mean, there's nothing wrong with it. You were born with it. Everything feels different to different people. And because you watched something on, the internet and you saw some porn, doesn't mean that's real. And porn is one of those things that is so integrated into culture right now that they think that porn, the genitals that you see on porn, is normal. So a lot of times people are worried that their stuff is not normal, and it makes them very self-conscious about what they have. And the things that you see in pornography is not what actually happens in real life. They're actors. They do things because they know people want to see A, B, and C, and they do A, B, and C very well. But it's just a job for them. And it's just always realize that this is not reality. Your reality is your own reality and what you've experienced with your own body, and just be okay with it and just be safe with it. And I think a lot of times, like she was saying, in college, you have this freedom because you don't have your parents there, so you kind of discovering yourself as an adult. And if you don't know how to pleasure yourself, it's really difficult to tell someone how to do a better job. Those that know what feels good and can communicate are destined to have a very good sex life because they could redirect. They could say, this feels better, try this. I've practiced with this, I looked up this, please try that.
All right, so for our last question, can we cover the topics of polyamory and some kinks and fetishes?
So, but polyamory is this idea of a kind of a relationship formation, right? And so most people are like, what do you mean relationship formation? So this idea of relationship formation is that they are this idea that, okay, are we in a monogamous relationship? So is our relational contract that we are the only two people within this relationship that we are agreeing to either kind of spend time with, build a life with, have sex with, right? But then there are other types of formations for non-monogamy. So you can have multiple people. You can have more of an open relationship. Again, this is a consensual contract between folks saying, hey, I want to be in this relationship, and the rules for this relationship is that I can have, sex or be intimate with you and maybe these other partners. We can have a polyfidelity relationship, so they're identified partners that are within the group. Or you can kind of just, again, have more of an open and just more polyamorous, where it's kind of whomever. But there's usually conversations about things like testing, use of condoms, so on and so forth that go along with that, and communication about how those things happen. So oftentimes people ask questions like, okay, well, how common is this? So there's not a ton of research out there kind of looking at the kind of the polyamorous or the poly community. But some of the larger studies that we've kind of looked at, roughly around maybe around 3,500 different married couples, suggest that about somewhere between 18 and 30% had parts of their relationship that allowed for non-monogamy, right? So it would fit within that context. And for cohabiting and not necessarily married individuals, that number actually is much more. And so it's, more common than we think. And oftentimes these conversations kind of evolve within a relationship and adds different aspects and spice to it. And so some folks kind of talk about it as a lifestyle and, allow for more love. Again, kind of coming within it. But everyone has to be on board and everyone has to be understanding as what actually is happening. If it's driven by one person and the other people are not happy with it, then we're talking about kind of more coercive, putting yourself in a situation that you're not comfortable with. So again, anytime we think about those aspects, we always want to think about consent and everyone being okay with the arrangement. If we want to kind of shift over into what people tend to call kind of like kink, kink has become a term more related, or a kind of a substitute term for BDSM, which stands for a wide variety of practices, so bondage, discipline, submission, dominance, sadism, and masochism, which oftentimes have overlapping features. But a lot of the times people are kind of discussing about things like using of ropes or other accessories that go along with the sexual practices, the idea of being submissive to one partner, and so on and so forth. Again, within that community, consent. All of this is really focused on this idea of communication, and everything is based on the idea of what is going to bring the partner's pleasure, right? And so these practices are, again, communicated, say, I like pressure, I like to feel submissive. And what a big misconception is the idea of the submissive partner really isn't kind of doing anything and it isn't running the show. But the submissive partner is actually running the whole show, because the sub, another word for the submissive in those situations, is actually the person that sets the limit. And it's up for the dominant partner, or the dom, to be able to understand the things that bring pleasure to their submissive and make sure that they orchestrate a kind of a play, right? Because this is oftentimes structured around structured play that is going to elicit the greatest amount of pleasure for that partner. So the Dom takes on a lot of responsibility and the submissive sets the limits, right? And so again, this is based in this context of communication and consent, right? And oftentimes the people that kind of go into, again, a more kink or BDSM type lifestyle go through a lot of training, actually. So there are places that allow for folks to kind of go in and be able to experiment and learn different aspects so that they are safe. Some of the practices, again, are revolving around bodily fluids, needle play, so on and so forth, which, again, is something that you have to have a general understanding of what's going to be able to transmit diseases and other infections, and making sure that it's safe for different partners. Oftentimes people run into problems where they kind of like, oh, I saw this on a video or thing, let's give it a try, without actually understanding that there are safe ways to do that type of play. And in terms of kind of general kind of prevalence or how often people kind of practice in this, there are a lot of studies that look at it and actually say that, estimate around 10% of individuals might engage in kink type play. And so we call kink related to these kind of extra aspects of sexual play, and talk about more kind of traditional aspects as vanilla, right? And to kind of put 10% in kind of perspective. Everyone's kind of familiar with the idea of kind of diabetes, right? And so national prevalence of diabetes hovers around 9.7%, right? So if you know somebody that has had diabetes and you're like, oh yeah, that's pretty common, you probably know someone that practices kink. And that's okay, again, because they have looked into something that has allowed them to be able to heighten their pleasure. This has especially become really popular after kind of popular media books like 50 Shades of Grey and things like that. I have many thoughts on 50 Shades. There are definitely better books out there that is so much better, that more accurately describe what it is to be a kink practitioner or to engage in a BDSM lifestyle. But at least it started a conversation around these different aspects of sexual play and how diverse the playground is. And then you also asked about fetishes. And so oftentimes people kind of use kink and fetishes as kind of interchangeable terms, but we think about a fetish as something that there is some sort of outside object or thing that it's like necessary for sexual interaction to occur, for that person to experience pleasure. It can be things like a body part. Foot fetishes tend to be kind of the more prevalent types of fetishes, but it could also be other types of objects like water bottle, high heel shoes, so on and so forth. And so for folks that have, a fetish, they have to have or would like to have that identified object or fetishized item when they're engaging in terms of sexual play, and that just kind of heightens their pleasure. And so oftentimes people then kind of start thinking about, well, if this is a fetish or if this is a kink, if this stuff, isn't that such a disorder, right? And so our general manual for like mental health, so the DSM, the Diagnostics and Statistical Manual, in its 5th edition, actually revised a lot of this section in terms of the paraphilias, right? This is what we tend to describe as atypical, but really aren't atypical sexual behaviors. And they really made a fine line and tried to describe that you can have a paraphilia, so like a fetish or engage in BDSM and not have a disorder, right? So you can have an interest, but it not be impacting your life in terms of causing significant amount of distress, not being consensual with another person, or impacting harm, right? So when we are talking about, BDSM in the traditional lifestyle, we're talking safe, consent, and everyone is kind of agreed upon and stuff. When we're thinking about disorder, we're thinking that this is forced onto another person. There may be a victim involved, or it's causing significant levels of distress. That was a really long-winded answer for...
I mean, that's a tough act to follow because she pretty much covered everything. the take-home points of all of that is essentially the same thing about communication. And what I've found typically in my practice is patients that have tried to engage in something different, it's because they're in the same relationship and they're getting bored, vanilla, and they want to try something different. And it's usually one partner that is interested and they suggest it. And because a person suggests it, it doesn't mean coercion. And I don't want you to think if one person says, hey, let's try this out, that's a bad thing. Trying is okay if you're willing to try, but you also have to be willing, as the person that's asking to try, to be willing to say, okay, we're not doing that. And just find out what's fun for you. And there's no deviance as long as everyone's on board. Like I said, with the exception of those two deviant things, as in, involvement with children or animals, things like that, everything else is pretty much fair game as long as you're safe about it, as long as you communicate, and as long as you're willing to get out when you want to. When things are no longer fun, you don't want anybody in the primary relationship or anybody in the relationship to feel hurt or used. And whenever you introduce any type of thing different from the vanilla, there's that option and there's that possibility of that. But have fun and just be careful. And if you are going to be doing things, body fluids can cause infections. Any type of lacerations or cuts or bruises or cuts need to be treated just like anything else.
Safe words are fun.
So did you want to provide any other resources for our students that they can maybe kind of get on campus or off campus?
So, we have a lot of great resources on campus. Here at the Wellness Center, they do have free condoms, both male and female condoms, dental dams as well. You can also pick up condoms, dental dams, lube, things like that over at our LGBTQ center over on main campus as well. Swinging by, many of our providers also have access to those sort of things, and we'll provide different samples. If you had any questions, going to the local health center, we'll be able to do that as well.
And as far as medical providers, I'm at ECU Physicians. You could always look me up. Whenever you meet a provider that you want to talk about, right from the get-go, say, I want to talk about this. Are you comfortable with this? If they show any type of hesitation, it is totally acceptable, and you're not committed to that one provider. You could just be like, I don't think I want to see this person. And that's important.
So thank you, Dr. Cunningham and Dr. Kansagor, for all of this information. It's been really helpful. And thank you all for watching today. We will see you next Wednesday. If you need any more information, check the description box. Bye.